The content provided by our bloggers or authors are of their opinion and are not intended to malign any religion, ethnic group, club, organization, company, municipality, individual, or anyone or anything.
He's a surgeon. He's a 100-ton boat captain. He's a lieutenant on Seaside Heights Beach Patrol in New Jersey. He's a member of the Coast Guard Auxiliary. He's Dr. Michael Kachmar. Need answers to your medical questions? We have them. Listen in to hear latest on medical topics related to all that and more.
Hello, everyone. This is Scrubbing Up with Dr. Michael Kachmar. How's everyone today? Today is October the 7th, the year of our Lord 2022.
Yeah, that's right.
And we have Jeremy here today.
Hey guys, how
Jeremy.
you doing?
So we're gonna do a really short show today, but we just want to say hello to everyone. This is our first series of intraoperative procedures. So we're gonna start doing procedures and showing you some of the stuff that we do in the operating room. Of course, we have some correspondence and email stuff. We're going to talk about Brazilian butt implants.
Oh, my favorite topic.
And also, this is medical and also has to do with my lifeguarding stuff about holes, digging holes in the ocean. But let's go back to, let's just talk about this case. This case I did today, it's a patient who had a tumor in his foot.
So you just did this today?
Yeah, just did it this morning.
All right, so this is hot
fresh.
off the press.
This is fresh, like catching a fresh fish. So this guy had a what we believe is a giant cell tumor of the foot, and the problem is he's on Coumadin, which is warfarin, for a history of a blood clot and a pulmonary embolism. So he's on warfarin. So what we do, a lot of doctors do, is we take you off the warfarin for about 3 days before you have the surgery, so you don't bleed that much. But we also, some doctors bridge you with another medication. It's a low molecular weight heparin, okay, Levinox. You could inject yourself. What I do with my patients, and I work with primary and cardiology with this guy, but basically what we decide is keep him off his warfarin for 3 days. We did an INR, a PT and PTT, which is INR, and see what his numbers were. It's below 2. So that's just a number to follow when you're on warfarin. If you want to, if you want therapeutic, you want to be like 2.5. It gets complicated, but bottom line is you got to watch it. So what we did is he comes in the hospital this morning. We give him 5,000 units of heparin, sub-Q. We don't use any tourniquets, nothing to stop the blood. You don't want to put any pressure on the vein. So we do this wet, which means there's no control of bleeding, so you're going to have more bleeding. These things are usually very vascular. We do use things to stop the bleeding like epinephrine. We use lidocaine with epinephrine. Doctors know what that is, but it's a vasoconstrictor that is an injectable. We also use gel foam, which is like this kind of white stuff with thrombin, which is it's a fluid that actually stops bleeding. Yeah. In compression, we use suction. We use a thing called a Bovie, and a lot of things that you don't know.
I got a Bovie, and
you
I love thrombin.
Right.
Yeah,
You love thrombin.
I love thrombin.
So anyway, we want to show this. So this is a case. This is just some of the stuff that I do. So I'm a board.
Before we go any further,
just give them my credentials.
In this show today, this short show we're doing, okay. For those of you who love those pimple popping sort of YouTube programs, this is going to be your jam, and that's no pun intended. So we're going to show you some things. So if you're
a child, you may not want to watch this.
Yeah, children, you don't want to let them see this. There's going to be some blood, and you're going to see what are they going to say? Just say it right now. You're going to see the tumor being pulled out of a foot. So just so you know, and we're about to see it now. So Dr. Kachmar is a board certified foot and ankle reconstructive surgeon. Yeah, and
before you go anything, Jeremy, put my credentials up. The Dr. Kachmar. It's down on the bottom there.
Oh yeah. Hold on a second. Hold on. Yeah. I'm off my game.
That's okay.
Yeah, there we go.
Right. So here we are. You got to hit that there.
No.
Yeah. And
nope.
Hit it again. Just whack it a couple times. Go right over the thing. Yeah, right there.
Nope.
Oh. No, that's no good.
Yeah,
Get rid of it.
I think the boys shut these down somehow.
So we'll go to the other one. Yeah. So if you want to get a hold of me, it's Dr. Kachmar.
There we go. I got it.
Okay, I'm sorry.
Yeah.
It's Dr. Kachmar at iCloud.com. Yeah, this is live. So DrKachmar at iCloud.com. So let's go, Jeremy. Let's look at the first video. So here we go.
Let's go to the videotape.
They're an amazing instrument. Just lower my voice a little bit. Yeah. No, you lower it over the. Yeah, there you go on the side there. So here it is right here. There's the wound. You can see it. It's quite large. And we have a tourniquet there, but we're not using it. That's just on in case. But we didn't inflate it.
Just in case you need it.
Right.
But where those parallel lines are right
that's
there.
where it is. Right.
That's
right.
Right there.
So we always put a tourniquet on just in case. We had to inflate it if we had such much bleeding that we wanted to control it. But I never use it.
You write yes and an arrow pointing down. So we know this is the foot. You're not trying to pull stuff out of the wrong foot. No. Okay. No. So yeah, that's a big thing, man.
Right.
That's a big thing. Imagine having that on your foot and wondering what the heck's going on.
So go to the next one.
Okay, so the next one is this one.
So this is just jumping.
Now you're recording. Come this way. So this is the front of the camera. That's the back of the camera.
So you've just cut into it. The tumor's still in there.
So there it is right there. Now we got a lot of bleeding here. Normally you don't have as much bleeding. We use a tourniquet, but we don't want to push any pressure on the vein, so we don't want to develop it. Now, so that's that. You can see it there.
Okay, so you've opened that up so you can see it clearly. She's dabbing away the blood,
probably,
so you can get okay.
So that's a singe retractor. So let's hit the next one here.
Go to the next one here.
Okay.
So here it's out now. There's the tumor taken out.
Oh yeah.
And you can see it's pretty big.
It's gnarly. Yeah.
Right, and that's the wound right there.
Oh, there you go. You got.
So we examine the wound for any more tumor
material.
And it's all clean. I know it looks gross and everything, but that's a giant cell tumor, pretty sure. Yeah. But we'll hold.
Look at that thing, though, man. That's a massive thing you pulled out.
Yeah. So we'll get the last one here. It's two more. So here now, there looks like a lot of blood because we use these things. It's about 100 cc's, maybe 50 to 100 cc's of blood, but. He was good going in, and rarely do we have to transfuse these people. But sometimes you get bleeding. It's not the end of the world. Right. Yeah, you can hit the next one, Jeremy. Here's our sponges. Now here what we do is I like dissecting it to see what it looks like inside. Sometimes these could be differential diagnosis on this would be foreign body granuloma. Could be a fibroma. It could be a atypical.
This is the type of thing you're looking for when you cut this open.
Trying to see what it. It could be atypical ganglion cyst, a fibroma. It could be a neurolioma. It could be a fat tumor. A nerve tumor. But the most common, if you look at it in the textbook, is a ganglion cyst, and then secondary is a giant cell tumor of tendon sheet, and then fibroma, and it goes on. So
you just said it on the thing.
Yeah. So I like to dissect looking, and then that goes to gross and micro. The pathologist will get it, and they'll look under the microscope and come up with a diagnosis. But we play with it back here.
So you may very well find out more about this piece here in the coming days.
Yeah. So this is an excisional biopsy. We basically removed it and see what it is. I don't think it's a tumor, anything malignant.
How does it feel in your hand when you touch it?
It's just fatty, And look how big it is. It's about it's about 2 inches, which is about 4 centimeters.
Yeah.
All right, thank you. You can shut that off.
So now go to the next one. So the last one is where it's all.
Right, so this is the foot now all mended up.
Right.
Okay.
Now I could have done something with the tissue. Sometimes we debride the tissue. What happened? How many volume?
Yeah, you told me to
Okay, yeah.
So
but basically what you have here is it's sutured. We left some of the redundant skin there. It'll suck up, but it's done. And there's no bleeding now. We stopped all the bleeding.
Seeing it sutured up like this, now how do you expect this to heal? How's it going to turn out?
It's perfect. He'll be
perfect.
Fine.
Yeah.
As long as it, the thing with a giant cell tumor, you could get rid of all this. The problem with a giant cell tumor of tendon sheet, they have a tendency to grow back.
Yeah.
And you have to try to get it all out. When we do a incisional biopsy, we're doing two things. First of all, before we go in there, we look at the history. We look at the where it is, the MRI. we have a second opinion with the radiologist, and we come up with what it is, what it isn't, what is differential diagnosis.
Right.
It didn't look like, and the guy's it's not a 9-year-old kid, so I wouldn't think it's an aggressive tumor. It wasn't invading anything. It wasn't invading the bones.
How old was the patient?
I think he's in his 60s.
60s. Okay.
So my
was this preventing how he walks?
He can't walk. Yeah, it was getting bigger, and it was painful.
It was painful.
It was huge. It's like a ball in your foot.
What's that pressing against in the foot to cause the pain then? Like, is it just the
pushing on
fact
the
that
nerves?
it's there?
Yeah. It's like putting a sock in your foot. Why does it hurt?
Right, I got you.
Put a small ball in there.
Yeah.
Put a marble. You're gonna
feel it.
You're gonna feel it. It's aggravating. So what happens is with this guy, it was getting bigger, it was getting painful. The problem is he's a bit high risk because he's on Coumadin, and he had a PE. Now a PE is a pulmonary embolism, and you get that when you're immobilized. Your age could increase the risk of it. Your immobilization. Having surgery.
Yeah.
So we're concerned. You don't want to have an issue. That's why, we're very concerned. Like right after now, when he went to recovery room, so he got 5,000 units of sub-Q heparin 20 minutes before the procedure. Right after the recovery room, his procedure took an hour. Right after that, he was in the recovery. I gave him 10 milligrams of warfarin, PO. And then at 3 o'clock, he just got another dose. He stays over at night in the hospital. He got another dose, sub-Q in his belly, of 5,000 units of heparin. And then he'll get another dose 8 hours later. And then tomorrow morning, he'll take another warfarin pill. Right. And then he'll be checked out in the morning. The residents will see him, make sure he has no difficulty breathing, no DVT. And then he'll go home. He checks his own warfarin levels. He has a machine at home. And so he'll keep taking it. He'll get up to a therapeutic level, which is anywhere between 2 to 5 is the therapeutic level, for the warfarin. Right. And we got to worry about bleeding, for sure. But
now, see, when I was watching those videos, and I'm sure a lot of people at home might be thinking this, like, so once you've taken the tumor out, okay, and you have it to the side, and you had your finger inside there, like feeling around in that. So how are you? I mean, you must have like amazing eyes, because I couldn't differentiate between one red piece to another. So when you had your finger in there. And you're looking for more tumor material?
No, we actually have a specialist in a hospital. He's called it's a he and she. They're tumor experts. And they live in a little
Is that it?
Yeah, we bring him in.
I was wondering. Yeah, I was wondering where you're going with this. I was like, is he serious, or is he taking the piss out of me?
I couldn't have you. We bring him in. Bring in Jose, the tumor expert.
Right.
Oh no, senor, I see. No. First of all, what you do, you don't see the whole surgery.
Right.
We irrigate it out. First of all, we have an idea of where the tumor is based on the MRI. Yeah. We look at the MRI and we map it out in the body. Right. I knew this tumor is going planarly more than dorsally. So already we knew the extent of it. And when you start cutting it, you could see the tissue planes. They become very obvious. And it's just like everything else. It takes time to understand it and see it and know it. But you could see the different levels. So absolutely, yes. I mean, it looks all like red, but I could see the differential. I could see arteries, nerves, veins. You can see muscle. You can see fat. And you can see abnormal tissue. The key with doing surgery, especially like this, is you should start from the area where it's normal tissue and go into abnormal tissue. And then it gives you, that's one trick to the trade, go from normal to abnormal. The other thing is that, again, in your mind's eye, you want to have the lesion and try to understand it mapped out from the MRI. Now, once we get it out, we flush it out with water, and we examine the wound. That's why I examine with my finger to feel it. I see if I feel anything. We look at it. We see if we see any abnormal tissue. If we have any tissue that we feel is abnormal, we take it out. Now,
because I'm thinking while I was watching, you have to be able to go. You have to go through that with a fine-tooth comb, looking for.
Yeah. And usually, I mean, if we thought it was something that's an aggressive tumor, you would just take a small piece and then maybe amputate the whole foot, something like that.
Shit, yeah.
This one really didn't look aggressive. It wasn't affecting the bone. We did a lot of blood work too to establish a better diagnosis. But getting back to how much you take, and now a ganglion cyst, you want to try to get where it's originating from, because a ganglion cyst, if you don't get it all out, a lot of times it can return. Giant cell tumor too usually comes off a tendon sheet or a joint capsule, but that's what they call it. They call it a giant cell tumor of tendon sheet. And so, but again, there's so many tumors. I'd be surprised this could be a. I'm sorry.
How long was this guy walking around with this?
I don't know. I don't remember.
Before he got to you,
I don't remember.
Like, yeah, because it seems to be. It was at a considerable size, so it doesn't just grow that big overnight. I mean, that grew over time, right?
No. But I see. We see a lot of tumors. So if anybody has a tumor in the foot, ankle, lower leg.
Yeah.
We got a guy coming in. He has a disease process where he produces a lot of cholesterol, a lot of so lymphedema. He's lymph products. So he's got these tumors all over his leg. Actually, he's a priest, and he can't wear shoes. So he's got a big one on his foot. He's got a couple around his ankle. So we're getting MRIs to map him out. And then we're going to bring him in, and we're going to remove the tumors. Hopefully, with him, we could use a blood pressure cuff. See, this guy here,
a barefoot vicar.
Yeah, barefoot vicar. Usually, we do these with a tourniquet, and we control the bleeding. The surgery could go a lot faster. I could see it, but in a case like this, you have to weigh the risk versus the benefit. And to put a thigh tourniquet, like we put a tourniquet around your thigh, it pushes on the vein, which causes trauma. Normally, it doesn't hurt you, if you're healthy and normal, and it also stops the blood flow. Now, in a person who has a history of blood clots in their vein, and a blood clot that went up to their lung, you got to do it wet. In my opinion, I mean, if you can.
Now, when you say wet, what do you?
No tourniquet. I don't. So when we do these cases normally, we put a tourniquet on and it stops all the blood. So we have no bleeding when I operate.
Okay.
Very minimal.
Okay.
Very minimal. Almost like nothing.
But in this case, you had to.
There's a ton of blood in this because he's first of all he's on blood thinners. Even though you take him off, he was on aspirin. Mm-hmm. We stopped the aspirin 5 to 7 days per the cardiologist, and the Coumadin 3 days. Even though it's gonna bleed.
Yeah.
It's just a part of the deal. Now you could, but if I had a tourniquet on somebody, there would be no blood.
Right.
Until you let the tourniquet down.
And in that one video where you see all the,
the gauze.
Oh boy.
Yeah, but we try to make a judgment. I would say no more than 100 cc's, probably like 50 to 60, but. You make sure they're going in. If you are a doctor listening to this tape, you make sure what their hemoglobin going in is. We don't operate on anybody if their hemoglobin is normally not electively, if their hemoglobin is 10 or below, below 10. We would probably, if they're like 9, say they're 8 or 9, we'd probably, transfuse them at least a unit of blood before we operate on them, get them tuned up a little bit. But he was 14. That's your hemoglobin. That's how much blood you have in your circulation. So he could stand to use a unit or two. Now, before he gets discharged tomorrow, I'll do what's called an H&H, hemoglobin hematocrit, which is a blood test to see if he dropped down a little bit. He might go down to 13 or even 12. That's fine. Have a couple steaks and he'll be fine. Right. He'll make blood. Your body makes blood. So it's not that big of a deal. Getting back to the DVT and the pulmonary embolism, these are tough cases, but some people, like I said, some people bridge them, what they call bridge. They take them off the Coumadin and put them on Levinox, which is a injectable that the patients give them. We use heparin in the hospital. One thing about heparin, if you give sub-Q heparin, it doesn't cause much bleeding in the wound. So I'll have people on heparin all the time. I don't mind operating on them. And that's that. So, the guy, hopefully he'll do fine. And that's our case of the week.
Yeah.
And if you, my name is Dr. Michael Kachmar. I'm a board-certified reconstructive foot and ankle surgeon. If you need surgery, if you have a tumor in your leg, your ankle, foot, any kind of benign tumor, let us know. Come and see us. Now, if I do see a tumor that's malignant, something that's really bad, especially in a child, I shoot them out to Philadelphia.
Right.
I have a friend out there who's he's a board-certified orthopedic oncologist. So he works and specializes in bad tumors. But we do fractures, we do infections, we do vascular stuff. So anyway, let's go, Jeremy. Let's change shifts here. Let's talk about a couple things I wanted to talk about.
Yeah.
And let's start with this one first because you're going to like this one. So go, as we say, go to the board. So this is pretty interesting here. This is... I heard about these and I've seen these, but I work down in the Caribbean. I just want to throw these out. This is called the. These are the biggest risk of a Brazilian. No thanks. Brazilian butt lift. So these are pretty. This is pretty.
So there's risks.
Oh yeah. I don't want to get into the whole thing, but this a lot of people. This was a big thing for a long time, and so what is
Brazilian butt lift?
Well,
exactly.
what is it? Right.
Yeah,
well, what they're doing is it's a cosmetic surgical procedure that changes the size and shape of your butt, and they shoot fat cells in here. The big problem with this is you could get a fat emboli. You could get a blood clot. I mean, a fat clot. Yeah. And I would be very, very cautious if you're having this done. I wouldn't do it. I would have a board certified.
So say you get a blood clot in your butt.
It goes into your artery or your vein.
Does.
Yes.
Oh.
No.
So what are they doing?
See, here's right here.
Thing?
If a surgeon is inexperienced or doesn't have good sense of anatomy, and goes too deep in the muscle, the fat can end up injuring the superior and inferior gluteal arteries, he explains. These blood vessels have a direct route to the heart. So if they are injured, the fat gets into them, and the fat can go right up the heart. The problem with the gas, like your gastroc muscle, your calf muscle and your butt muscle have huge veins and arteries. They're big muscles. They got a lot of blood supply. And I don't know, if the fat goes into the artery. I think it goes into the vein. I know there's big veins in the calf, but my point is that you have to be very, very careful with this. This says arteries. It might be the veins. Yeah. But I'm not a plastic surgeon. I don't do this stuff. But I can tell you, a fat embolism, you have to be very cautious about, all right? And it has to be the right person, knows what they're doing.
Right.
All right. So, Jeremy, just get me off out of this for a minute. I want to get another one here. So that was the one I thought was pretty funny. Any plastic surgery, well, people go down to Mexico and get these things done, and they never come back. They wind up.
What, they go missing?
Well, they die. They have a procedure and they throw a clot and they die down there in the hospital.
Yeah.
They die. They die in a hospital. I just think that butt implants you have to be very careful with because they are dangerous. Another thing I wanted to bring up. This isn't just another thing because I know we're going fast today. So I have had some friends who talk to me. They go hiking, and I used to do. I used to belong to the Conservation Medical Society, where these doctors we deal with a lot of stuff in people who climb mountains, scuba diving, surfing injuries. So here's something interesting. When you go hiking, right, you go up a mountain, you go high. But if you go places like Colorado, Denver, which is mile high, you have these places where you could get really high, and you could actually get altitude sickness, which is where you have less oxygen. So just put this up for me.
So you're going up there. Right. for the little air. The blood is rushing to your head, and you might be up there a little too long, and bad stuff happens.
Right. So altitude sickness can ruin your hike. Here's how to prevent it. It says getting high is not always as fun as it sounds. I just want to put it out for people. If you go away on a vacation down the Caribbean, anywhere, some of these mountains that you go are 2,000, feet high. And if you're like in Denver, for example, or Jackson Hole, you're about a mile above sea level to begin with. And then you go another mile up. Now you're 2 miles up. You're going to start feeling that. You're going to start feeling because what happens is the air gets less oxygen up there. And that's called altitude sickness. Now,
so these people are purposely going up there to get high from the altitude?
No.
I'm going to say there's other means to do that. Just get a can of freaking whipped cream, man.
No,
what's going on?
They're going up to hike and they're getting sick.
Oh, okay. All right. Okay. But whilst they're up there,
but listen to this here.
I feel so great.
So here's the interesting thing. Contrary to here, listen to though. But we talk about the higher you go up, there's less oxygen. But listen to this. Right. Contrary to popular belief, altitude sickness doesn't happen because there's less oxygen. The higher you go, you're still breathing 20% oxygen. It's just more spread out. Explains whatever this education. Blah 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 blah. It's not a matter of composition, but concentration. At high altitudes, there's less atmospheric pressure, which reduces the number of oxygen molecules in a given volume of air compared to the, But you know what it is? That gets confusing, but basically, you're not getting enough oxygen.
Right.
All right? And I think, this guy's getting esoteric. But, that's why when you have pilots back in, like, the World War II, they had to wear oxygen masks. If you go above 10...
because there was no...
if you go above 10,000 feet in a plane, you'll pass out.
They weren't pressurized,
You'll pass out. That's why you need supplement oxygen. And is not fun.
That makes sense. I never really thought about that, although I watched so many war movies. You'd think I'd...
No.
You think I'd have put it together.
So the symptoms will likely involve a headache, nausea, possible vomiting, and even loss of appetite. Sometimes it may be also accompanied by extreme agitating tiredness and insomnia. So that's it. You could read this here. This is a good article right here for people who don't have, who are not on the what do you call it?
If you're not watching us live on YouTube,
you should go over to it.
Our Facebook page and Rumble. Because remember, those of you who may be listening to us on a podcast without video, we do have a video version of our show, and you can watch those. They're archived on our Facebook, our YouTube, and our Rumble channels.
Right. So anyway, if you're going away on vacation, be careful. Pay attention how high you're going up. I was in Jackson Hole, right, which is a mile up. We went up to a ski resort for a restaurant. It was another mile up. We were 2 miles up. And I tell you, I had a couple drinks up there. Yeah. I was friggin' hammered. And I was sick. I mean, I was throwing up, coming down, and I was like, "How did I get so drunk? I only had a couple drinks, I had I must have had altitude sickness."
Yeah, I was gonna say because they serve drinks 2 miles down too. You know that, right?
Yeah. Well, we had dinner up there, so we got one more here. I'm going to show you this now for people who watch the show. They know that I. Work as a lifeguard too. We have we have another show. I don't want to say competing show, but a complimentary show. It's called Lifeguarding. A sister show. It's called Lifeguarding with Dr. Michael Kachmar. Yeah. And that show, we talk about lifeguarding stuff. But I came to this article. This is medical and lifeguarding. We do not allow holes to be dug on our beach. Basically, you could have a hole 2 foot deep. Right. No more than that. And we had a kid in June, a mile up our beach, die in a hole.
Oh, shit.
Right? They dug it so deep. But here's another reason why we don't like holes. A lot of people will build a hole, dig a hole, not that deep, and then they leave them, and then people walking along the beach, say in the evening or at night, fall into the hole. And here's a great one. Here, woman breaks leg after falling into unfilled hole at beach, warns others. And basically, this woman here, 58-year-old 58-year-old mother is urging people to never walk alone on a beach at the end of the day without filling in holes. Okay, blah, 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 blah.
Probably the most... hang on, go back up.
I'm sorry.
Probably the most horrific physical pain I have had in my life, she says.
Had to go under surgery.
Yeah.
Still unable to walk 6 weeks after the experts...
Pays thousands of dollars in medical bills. I mean, this is what we're doing to people, just because we can't clean up after ourselves.
Here's her incision.
Oh my God!
And and what happens is that the kids dig the holes. People are like, I go down there and I talk to them. They're like, well, what's the problem? I'm like, listen, you could fall in there, or what's another thing? At night we have either police or lifeguards patrolling the beach, and if you hit one of those holes, you go flying over your ATV. Let's just say, it gets dark around. It's getting like say 8:30. We get called down there. We're not lifeguarding anymore, but somebody's drowning.
Yeah.
Somebody's drowning. We're bringing emergency vehicles onto the beach. We hit one of these holes, we're gone, man. You hurt yourself really bad. So there's some tips here. It says it was evening, so they used the light on their phones to illuminate the way they walked the edge. A few minutes later, they turned around and started to walk back. I took a couple of steps and fell in. I tell you, it's really hard.
My leg went down to the knee, straight down, but my body kept going forward. Oh, yeah, so you got the momentum.
Right.
I'm trying to read this stuff.
I'm sorry.
When I came out of the hole, I just instantly grabbed my knee, and I was rolling around in pain.
Yeah. Now, put the mute this thing here. I don't want anybody to hear this. This is a video here of the kid who
now tonight
died.
with Joshua Johnson.
Just hit the video.
Weeknights at 8
Oh, no,
NBC
you have to mute it because it's on your screen.
No, you mute it up over there. Oh, to the right. It says Mike iPad on to the left. Left. No, all the way to the left. Your left.
Oh.
Left of the screen. See where it says
Oh,
Mike's
yeah,
iPad?
my left, yeah.
All the way down. Right there it says iPad. Yeah.
Oh, okay.
That's
right
our. We'll mute the
No,
other one
mute
right there
this
when I
one.
go. Let me try it here.
Yeah.
So this is this happened,
Okay.
and
You didn't warn me about that one.
yeah. So here's the hole. See the hole right here? Look at that. 2 kids. He died. 18-year-old kid. This was in June. And the sister was in there. He was in there. They never got him. The time they got him, he was dead.
Here's my point here. Like, look at this. Look at how they got a backhoe out there to figure this out. How was it? How was that kid allowed to have?
There was no lifeguards there.
20, 30 foot ravines.
Yeah, you could. So what happened was this was in June before lifeguards were on the beach. They're a very nice family. They came down from Maine. It was 2 18-year-old and a 17-year-old girl. They had Frisbees, and that's how they were digging a hole. The water was freezing cold, so they didn't go in. So what they did to pass the time of day is they dug a hole. It got to the point where the hole was so deep that she was on top of his shoulders. In fact, she was getting out of the hole and on his shoulders when she was trying to get out. The sides caved in. So when they got there,
Is that what happened?
what got there, she was up to her chest in sand. She couldn't move. So the first responders got there and dug her out and pulled her out. And she says, my brother is underneath me. So they dug down as fast as they could. They got to him, and he was dead already. They put a monitor on him. They put an EKG.
Oh,
you know,
my God.
and he was.
Wait, so she was standing on his shoulders
Yes.
the entire time while they were buried,
Yeah,
and he died just under her feet.
yeah.
Oh, she's got to live with that for the rest of her freaking life now.
Well,
Some stupid little escapade on a beach just because the water was cold.
yeah. Well,
Unbelievable.
listen, you can't blame them. I mean, we have our hearts go out to them. People, weren't thinking.
I'm
you think about it.
extremely sorry it happened, but we got to make some smarter choices. Oh my God, she's going to be haunted the rest of her days because of this now.
Well, I have people on the beach who dig holes, and they get nasty with me when I tell them not to do it.
She's going to have an aversion to beaches. She's not going to want to go on vacations. I mean, that's the people's lives get ruined when you make silly little things like this happen.
Well, I see. I give a benefit of doubt to people who are young and they make mistakes. We all do.
But
We all-
mistakes, man, mistakes have consequences.
Yeah. Well, whoever thought digging a hole? I mean, really, you don't think so?
I get you.
I mean, dig a hole. So I have little kids who dig holes and they try to connect the tunnels, and parents don't think anything of it. You don't realize is that when you get sand in your mouth, it's like choking. It's like getting swallowing something bad. So anyway,
I just realized that, and you know how I have an aversion to sand. That is a nightmare. I never contemplated, and now I will. And oh my God!
Well, the thing that I wanted to make a point of is that is showing that with the hole,
suffocating in sand.
It's not just people die in a hole. You create a hazard. People fall down, break their legs. Emergency vehicles get shit in there. So if you dig a hole, bury it. That's one of the reasons why.
Where was that?
Where was what?
The sister and the brother.
Oh, I don't know. No. But I can tell you. I can tell you this. We have an ordinance. You can't go any more than 24 inches, which is about 2 foot. And sometimes we shouldn't even allow that.
You shouldn't.
But but kids want to play. Here's the thing.
A baby can get covered up in 2 foot of sand.
Well, listen, we keep an eye on it. We come to the decision. You got to live and let live. There's a certain amount of things. You listen. People die in car accidents all the time, right? Yeah. Why don't we tell everybody you can't go more than 25 miles an hour on the parkway?
I'm not telling kids that they can't put a moat around their sandcastle.
Well, but 2 foot is like this, Jeremy. 2 foot's like this. I mean, where do you? Oh, okay, 1 foot. I mean,
that's 1 foot.
You can't do this. You can't do that. Okay, if you want to save lives, don't let people drive.
But double that as a baby.
Well, don't put a baby in. Listen, they have babies floating in the ocean. I tell them go in when there's big waves. People bring their little babies, and we got to go down and tell them, get them out. And they give me a hard time. So trust me, you're dealing with the whole different, Yeah. I mean, this is the lifeguard show. I don't want to get into that. Medicine.
I just feel so sad for this woman and God. I mean, God bless her and her family.
Sad.
I hope that they're able to get through this, okay. That's a nightmare. I can't even begin to wrap my head around.
We just had, you talk about that. We just had one where I'm treating one of the patients. There was a horrific car accident. 3 guys got killed, 3 friends got killed last Saturday, 24th of September. Instantaneously got killed. It was a tragedy in this area, you know. And somebody was coming down the road at night. You got to be very careful if you pull over to the side of the road for whatever reason. You know, your car breaks down, you hit a deer, you got to use the bathroom. You know, you see something in the road. You know, maybe you got a flat tire. You got to be careful. Put lights out, because what happens is people coming down the road don't see you sometimes. And this woman, I have no idea if she was intoxicated or anything like that, but she was coming down the road and she hit the three guys, killed them instantly. You know, they were near a car. So anyway, Jeremy, listen, we thank you for our case of the week, right?
Yeah, everybody.
And we're gonna keep packing out. Jeremy, you got a show tomorrow? What are you doing tomorrow?
Yeah, I think I got Dr. Jasper Painless.
Oh boy, that's gonna be a good
Dr.
one.
Gabriel Jasper.
Good.
That's going to be at 10 o'clock tomorrow morning. So
I want to do a show with him about the Taiwanese kids who are in the cave.
In the cave.
Tell him I want to do a show with him next week with that.
There's a video or documentary
yes,
already
yes,
made
I read it. Yeah, I watched it. So what we're gonna do is tell him Dr. Kachmar is gonna quiz him, and we're gonna see what Jeremy would have done if they brought him there.
Brilliant.
Right. We would have seen. That would be good. See what he came up with.
I would never even be putting that. I wouldn't put myself in that. Maybe once upon a time I might have, but now,
Jeremy, not for nothing. You wouldn't be able. You know, if you're claustrophobic,
it's not happening, man. It's not happening.
So everyone, listen. I'm Dr. Michael Kachmar. Get a hold of us at drkachmar at icloud.com. Jersey Shore Foot and Leg Center. If Jeremy could throw that up, if he knows how to do it. Jersey Shore Foot and Leg Center.com. Give us a call. My office number is 732-269-1133. And again, we're going to try to show more surgical interventions. I know they're a little bit gross, but this is what it is. And people like to see that.
People like to see stuff like that,
They watch
too.
that pimple pop. That thing is nasty.
Oh,
so,
I can't even.
So was this as good? Was this just as good?
This was just as good as that.
Right, am I competing?
You're totally competing with that.
Yeah,
holy shit.
Go.
But like for those of you who love this show and want to see more, please like and subscribe where applicable. And please share our show on your Facebook or your social media channels.
Yes.
Because it's only you who can make us grow bigger.
Thank you very much.
If you do that, we'll keep making these shows, I promise you.
All right, thank you. Take us out, Jeremy.
Take us out.
Have a nice
care,
weekend.
everybody. Be kind to one another.